Good morning, Dr. Hedman. Welcome back. Welcome back. How are you today?
I'm doing very well, Mr. Lawson. Thank you for the invitation, a chance to go and talk a little bit more about medical cannabis and the many different aspects are now becoming part of the world of medicine. Thankfully, after all this time.
Absolutely, absolutely. Today, we plan to get into a conversation about the endocannabinoid system.
Okay, very good.
The ECS. And many cannabis consumers are not aware of what it is or what its function is. But more importantly, as you know, many physicians and medical professionals are also not well versed in what the endocannabinoid system is, its function, and its relation to the cannabis plant.
Mhm.
And so we'll take a dive into that, and I'll let you have the floor. So let's talk a little bit about that. What can you tell us? What is the endocannabinoid system?
Well, oh yes, I'd like to maybe just go back a little bit. I've been, working with medical cannabis patients for the past 10 years plus. And I have to say, when I first started, it was disturbing to hear patients recall that their personal physicians were dismissing them as, not really, that it's just all in their head. And, they're only getting the effect because they're getting the cannabis high. And it didn't help that there was an article that was published in Time magazine by Sanjay Gupta that pretty much implied that people using medical cannabis and was quote, malingers that wanted to get high. And so he did that in back in 2009. To his credit, he either got pushback or he decided to go out and make a documentary to prove his point.
Right. I remember that. I remember that.
He came up with that, that weed documentary.
Right.
To his credit, he got back on CNN.
Right.
And he said, I apologize.
He was wrong.
I was wrong.
I remember that. Yeah, that's a big deal.
So the background of the endocannabinoid system actually goes back. They actually identified the what we call now the CB1 receptor back in 1988. And it was determined that this particular receptor was found pretty much in brain tissue and in the peripheral nervous system. Subsequent to that, they identified a second cannabinoid receptor, CB2, which seemed to be primarily found in the immune system, in the leukocytes and macrophages. And so once you identified that, then it was pretty much a simple thing. The body doesn't make receptors just for the sake of having nothing to work with. And so we have pretty much the same as there's the endocrine system, which the body produces these hormones. Body also produces endocannabinoids. And the two ones that have been both easily identified and studied is one called anandamide, and the other one is called 2-arachidonyl glycerol. It's a mouthful.
Right.
So it's easily just in common voice usually referred to as 2-AG.
Got it.
So these are the ones the most studied, and although I will say there are other compounds that appear to have interaction with the endocannabinoid system also.
Got it.
Also, there appears to be other receptors in the body that seem to interact with the functions of the endocannabinoid system. And I won't get into those serotonin receptors, capsaicin receptors. So, those are all, I would say, more secondary. So, 2-AG and anandamide are the big ones. So as I said, the CB1 receptors are found predominantly in the brain, and they appear to be mostly within the neurosynaptic areas. The brain, 85 billion cells. So, So it has quite a lot of interaction with being able to influence brain function in the different levels.
Got it.
And also in the peripheral nerve, it's been identified clearly that the CB1 receptors will tend to adjust or inhibit neurotransmitter activity. So what that basically says, if you have a pain receptor that's firing right along, the activation of the CB1 receptor will reduce nerve activity and nerve transmission. So the brain gets less impulses in its ability to, interpret pain. Voila,
Absolutely.
voila.
Absolutely. That makes a lot of sense.
Yeah.
Not to interrupt you. And I have a personal anecdote to confirm that for sure. But uh, so basically, the brain has receptors that are made to receive cannabinoids from the cannabis plant, to receive these compounds from the cannabis
Mhm.
plant.
Mhm. Well, they were meant to go and basically interact with the body's production of these other endocannabinoids. It just so happens that the cannabis has what we call phytocannabinoids, and
Okay,
they interact with the same receptors.
got it. Got it. Now, is it true that
So
I was reading that is it all mammals have an endocannabinoid system? Or just
pretty
human?
much all mammals, birds, a lot of the studies that have been done is done on, rats, mice, and other, mammals to sort of try to, figure out what other things they can tweak out from what the function of the endocannabinoid system does.
Got it. And so, from my understanding, the ECS, because we know these words can be a mouthful, the ECS, that in terms of its function, we're talking about appetite, immunity,
Mhm, mhm.
memory, energy,
Yep,
mood.
yep,
Yeah,
yep,
can you
yep.
speak to the various
Well,
aspects of?
yeah. Well, I'll keep going with the different aspects that wherever we find these receptors, we pretty much feel they are having some role in homeostasis and normal function.
Got it.
They're the CB2 receptors I mentioned that were in the immune system.
Right.
And the immune system is actually what tends to go and regulate the inflammatory response in our bodies.
Got it.
Again, as we can tell from too much inflammation is not a good thing.
Right.
The part of the whole thing about COVID was that people were having these, very escalated inflammatory responses that were just beating up lung tissue through
Right.
cytokines. So we basically have found that the brain, the CB1 receptors seem to be able to in the brain not only adjust brain function and enhance brain function, it also has a neuroprotective ability to go and help the brain recover, be protected from both chemical and traumatic injury,
Mm,
as well as also has some role in, I believe, in what we call neurogenesis, that is reproducing new brain cells and new pathways to make up for damaged areas.
wow, that's interesting.
So, yeah. So, and as part of that, again, it's always in brain, in nerve tissue. So it also has been identified as being, part of the autonomic nervous system.
Mm,
And the autonomic nervous system, multiple, as it says, it's what keeps our body going without us having to think about it.
right.
One of the more important parts of the autonomic nervous system is the vagal nerve, and the vagal nerve itself innervates the GI tract. And so probably when so many people talk about how, they're able to get nausea relief
Right.
through cannabis, it's in the enhanced effect of the cannabis on the receptors on the vagus nerve.
Right. And I'm glad you mentioned that because I think that's really what I want to dial into in this interview is people are mitigating all of these symptoms, right? Pain,
Mhm.
nausea, so on and so forth. And all of that is directly related to the endocannabinoid system. And
So it would appear, yeah.
yeah, and I'll tell you a personal story. I actually forgot to share this with you before the interview started, but I'm embarking on this 30-day cannabis cleanse, right?
All
Where
right.
I'm not using any cannabinoids, no extracts,
Mhm.
CBD, CBN. I'm
Mhm.
not. I'm an inhalation guy, so I'm not smoking at all.
Mhm.
And man, when I tell you that I have felt the difference immediately. I rode my bike the other day, did about 10 miles in the morning, and my energy levels were just through the roof. I was feeling great. So I said, I'm gonna play some soccer in the evening. Went and played some
Mhm.
soccer. And when I tell you, this was 2 days ago, but yesterday I had to take an ibuprofen because I was still in pain. And I was scratching my head, wondering, like, man, why am I feeling like this? I feel terrible. And then it
Mhm.
dawned on me, I typically use cannabis before and after I exercise, particularly exercise heavy. If I do 20, 30 miles on the bike, I'm definitely using cannabis after the fact.
Oh, yeah.
And
Yeah.
when I tell you the difference was like night and day, it I'm
Yeah.
still feeling soreness today. That was
Yeah.
Monday. Today is Thursday. And
Yeah.
so we cannot take for granted the ability for this plant to mitigate. We could just talk about pain and inflammation,
Right.
in
Right.
that case.
Again, we're back to it being able to reduce the inflammatory products that get produced from damage or overuse, or again, the cytokines being reduced by the endocannabinoids.
Got it. So we're talking about you mentioned nausea, pain. Um, what other aspects of the ECS are influenced by the cannabis plant?
Well, there's other things. The cannabis plant, again, it just introduces phytocannabinoids to enhance the inherent effects of the underlying the endocrine ECS through the receptors.
Got it.
And so, most any effect, I can give you an example I remember from a lecture. They did a study one time where they looked at normal bowel, and they measured the numbers of CB2 receptors in normal bowel. And then they took bowel that was suffering from inflammatory bowel disease, Crohn's disease, ulcerative colitis. And what they found was that there were twice as many CB2 receptors in the inflamed bowel. In
Wow.
a way, it was like the body was, okay, we know something's not right. We need to try and calm this down. Let's get some more CB2 receptors produced so that the circulating anandamide and 2-AG can do some benefit. So when we introduce phytocannabinoids, they certainly enhance the effect of those CB2 receptors. And I have a dozen or two patients with, inflammatory bowel disease. And whereas, they've been given the usual Western medicine, they themselves are taking a pretty healthy dose of cannabis to keep their inflammatory bowel symptoms under control.
That's
So,
interesting.
so
Interesting.
I had one lady that at one time was diagnosed with pretty severe Crohn's disease,
Mm.
couldn't handle any of the biologics. She had just given up. She came in to get some cannabis for relief, and I said, if you take a little bit more than usual, you might do really well. So she did take that to heart. And the last time I saw her, she brought in a printout of what the inflammatory markers, and they were interpreted as showing mild Crohn's disease. And that's all
Wow.
she was using for. So
Wow.
yeah, a very important effect on inflammation, and all can be seen through the endocannabinoid system. And again, the phytocannabinoids enhance that.
Thank you for sharing that. Can you tell us also, could you share with your patients who are suffering from that, what's the route of administration that they're using for cannabis to mitigate that?
Generally, it's been oral.
Okay.
Uh, because you need, as I mentioned before, oral ingestion tends to last longer and have a more pronounced effect. And when I say they're using higher than usual amounts, we're on the order of 200 to 400 milligrams a day. A
Okay.
lot of people get that through something, some people recognize Rick Simpson oil. We also now know it as FICO, full extract cannabis oil. It's a
Mm,
very, thick concentrate, but other people will use just, fairly highly more concentrated types of tinctures or whatnot to achieve that goal. And again, it's, a lot of individual differences are in play, but, people tell me what they're feeling and how they're doing, and they don't have any reason to, enhance the situation. They're telling me exactly what they're doing and how they're feeling.
right. I'm glad you mentioned that because I was going to ask you what you meant by a healthy dose, right?
Yeah, yeah. Yeah. So, every dosing is individualized.
Right.
And I say there are some people that seemingly can get the necessary medicinal benefits from 5 to 10 milligrams of cannabis a day, which we would almost classify as microdosing.
Right.
There are other people who seem to need more, again, 100 to 200 milligrams, sometimes as much as 600 milligrams a day to achieve that. And so, again, you try to use I say you use just the right amount to get to what I call the Goldilocks zone,
Right.
get just enough of the right thing. And again, and we're back to, how much of it is THC, CBD, and the newer
Mm.
cannabinoids that's now being made on the market. It's sometimes you can say, well, try this and try that and adjust accordingly.
Right. What are your thoughts on the ECS and sleep, right? Because I know another thing I've noticed, I'm only on day 6 of my cannabis cleanse, and by day 4 I had to go get some melatonin
Yeah,
because my
yeah.
sleep was not restorative, to say the least. Um and the I used a 10 milligram capsule of melatonin
Hmm.
two nights ago. It was very effective. I actually skipped it last night because I was interested to see the effects, if the melatonin was kind of still in my system, if I would still feel the effects. And I I didn't have any sleep disturbances, so to speak, but I didn't get the most restorative sleep either. Right. And
Hmm.
so I think I will use it again this evening. But can you speak to the ECS and how is there any relation to that
Well,
in sleep?
well, again, so much of sleep patterns is dependent upon, brain function, stage 1, stage 2, stage 3, stage 4 sleep. I've been told that one way that the cannabis, THC in particular, seems to help with patients with PTSD and their nightmares is that it actually keeps the brain out of stage 3 sleep for a longer period of time.
Mm,
And so stage 3 is where you have your dreams. So
right.
if you're not in stage 3 sleep for very long, then it's you're not likely to have as much or as vivid nightmares. But yes, again, it's back to going to assessing, reducing neurotransmission. A lot of trouble. A lot of people have trouble sleeping just from their general anxiety,
Right.
and so if you can reduce the anxiety, then you can enhance a more restful period of sleep for the individual. And this pretty much, I don't know if we all have anxiety these days because of the world in which we live,
Right.
but I will say that time and time again, patients will tell me, yes, it's doing great for my back. Yes, don't have the nausea, but I really need it to help me sleep.
Oh,
And
absolutely. I'm a testament to that. I suffer from post-traumatic stress
mhm,
and sleep. I think just for anybody, regardless of what your condition is, sleep is just is necessary no matter what.
absolutely,
But
yeah,
I have noticed 100% that if I do not use cannabis in the evening, particularly before bed, my dreams are just very busy. They're very busy. They're very vivid. Um, and I find myself oftentimes waking up exhausted. If
mhm,
I have a dream where I'm running or I'm chasing someone or I'm being
yeah,
chased,
yeah, no,
you know,
night terrors, yeah.
I
Mhm.
wake up exhausted. I've had dreams where I might be in some kind of violent encounter, and I've actually awakened with, sore muscles.
Mhm, mhm,
It's incredible. And so, me personally, I usually, prior to my cannabis cleanse, I usually would inhale about a gram of a very strong OG, um, or endocannabinoid strain, and
mhm,
the most restorative sleep ever. I mean, I'll get 6 hours of sleep and it will feel like eight.
mhm.
8 hours of sleep will feel like 10. And so, um, I'm glad you shared that. And so, what other let's talk about mood and the ECS. Does when we talk about balance and homeostasis?
Right, right. Well, I guess, mood is, I will say that the anandamide has been sort of given the moniker of being the bliss hormone.
Mm,
And so the things that people will do to try to either enhance production of and the circulation of anandamide will affect, their mood in general. Um, I do remember that there was the for well it was well established that the runner's high that people
right,
get is from, everybody knows it's from, and endorphin production.
right.
Well, not so much. There is probably
Mm,
some endorphin production because running can be, it's a type of trauma, but there was, studies started to come out that suggested that part of this runner's high, this euphoria that people would get, was from production of increased amounts of circulating endocannabinoids, specifically anandamide.
mm,
And there was a study that was done not too terribly long ago, where they looked at 33 previous studies that had various amounts of measurements of exercise and circulating endocannabinoids. Pretty much, they found that most any exercise, including running, would increase circulating endocannabinoids. And so people would get the people after a good run, and you may know this, you feel relaxed,
mhm,
you're in a
mhm.
good mood,
Yeah.
the troubles of the world are way behind you, and it's all good. And you've got, your body's cranked out a extra dosing of anandamide to make that happen.
Interesting. Interesting. So you're saying that traditionally we've been thinking it's the endorphins, but
That was a classic way, yeah.
right,
Yeah.
classically it's the thought
But
was the endorphins is the running high, but really you're saying it's the anandamide.
it's the anandamide. Mhm. Yep.
Interesting.
If I may share my personal thing, I've been involved with a choral group here in Portland for, probably, gosh, 14 years now. And I will say that, I always used to, I go to rehearsal, I'd come home feeling good. But I got home, the troubles of the world are back. But I
Mm,
always felt good. And even after concerts, after you put through, 2 hours worth of singing, you just come out feeling really good.
mm,
And so there have been, again, studies have looked at singing and dancing. There's a few studies out there where they measure levels of an entomide before people go off to sing and then afterwards. And surprise, surprise, there's been as much average of 42% increase in anandamide circulation. So
right.
to me, it's, oh, no wonder.
Right.
So
42%. That's a high number. So, I think an interesting question for me, and I think some of our listeners might be curious. It sounds like cannabis plant it enhances our quality of life, particularly by its interaction with the ECS. And we know that there are no documented cases of a cannabis overdose, right? Um, However, it is it possible to overload the endocannabinoid system with too much cannabis or create an imbalance? Or what are your thoughts on that for those who might feel like they're smoking too much or they're using too much or whatever their route of administration is?
and that's another one of those little nebulous points there, whereas particularly with medical patients, they're using, cannabis on a pretty regular daily basis.
Right.
But sometimes I get an impression as I'm talking to people, they're finding out, well, I'm needing to use, more and more over these past few months. And I said, well, you may need to go and take what we call a cannabis hiatus. That you
Right.
actually really need to, and part of the whole thought is that these receptors are getting overloaded. The same thing happens with other receptors in the body if they're constantly bombarded with their ligands, that they actually have to take a break from it and allow the receptors to reset.
Right.
That there's a condition, cannabis hyperemesis syndrome, which
Mhm.
is thought it does have a genetic predisposition for one thing.
Oh,
So
interesting.
it's not like everybody has it, but it is said that pretty much when you have a situation where it seems like one is suffering from this syndrome, the route of treatment is to basically take a break,
Got it.
2 weeks, 4 weeks, to pretty much allow things to reset. But for even with people who are just finding that it's taken more and more to achieve whatever level of benefit, then yes, taking a 1 day break or 2 days in every 2 weeks seems to be an easy way to reset. Doesn't appear that you have to be off of it for a very long time to help things reset, and then restart at whatever level gets you back to your Goldilocks zone.
Absolutely. I totally agree with that. I think I'm doing this 30-day challenge for a lot of different reasons. I have a couple
Mhm,
whys and we can get into that later, but um I have a personal testimony to the 24 to 48 to 72-hour hiatus.
mhm,
Anytime my throat gets scratchy or I'm not feeling 100%, I might take a day or two off. And I
mhm,
certainly, without a doubt, feel my tolerance level go way down,
mhm, mhm.
way
Yeah,
down, even in
yeah,
a 72-hour period. So I'm kind of nervous, honestly, about this 30-day cleanse.
yeah.
And when I start back, I'm going to have to really start back really slow.
Well,
Um,
again, yeah, you just, take the little bit, see what affects it, take a little more and see what it takes to get you back to, your zone.
Absolutely. So I have another question. When I was at the Emerald Conference, shout
Mhm,
out to MJ Biz Science,
mhm,
amazing conference in San Diego. Some of the uh, great minds in cannabis science were there. And Dr. Piamelli from the University of Irvine was the keynote speaker. And I asked him a question about pediatric medicine in terms of cannabis, right? When we're looking at
mhm,
our young people that are using cannabis extracts or compounds or isolates or whatever for particular symptoms. And the question was, I asked him his thoughts on just cannabis pediatric medicine, and he responded. I was kind of surprised that he believes that maybe we should not be tinkering with the endocannabinoid system with young children because it's still developing, and the science and the data is not in yet in that regard. What are your thoughts on that?
Well, again, a good part of the effects of the ECS system goes through brain and nervous tissue.
Right.
And it is well established that, even our brains don't kind of finally mature till we get to about 25 and we start to act more responsible.
Right.
So, um, so I can't say that I have a whole lot of pediatric patients that I've worked with, but I will say the patients that I'm having with that are pediatric are dealing with some pretty heavy duty stuff, and
I
they're
was
dealing
just
with
about to mention that.
autism,
Yes.
and they're dealing with epilepsy. And let's face it, I mean, you've got a malfunctioning brain already.
Right.
So anything you can do to improve that and stabilize that is going to have a good long-term result. But as far as somebody in the general population, using using cannabis, it's really, everybody, in the absence of known data, people are going to try to go back to take a more conservative approach and
Right.
cite and try and use whatever information we have already, enhance and basically translated to, recommendations when it comes to cannabis use.
Absolutely.
Uh, I wish I could remember the precise day. There was actually a very large study that actually reviewed a lot of articles about the use of cannabis in, if you will, younger patients. There was a whole concern it would cause permanent brain damage.
Right.
Well, they actually sorted through the different studies, and some of the studies were well corrected, and other studies they didn't quite correct for the use of other recreational drugs. And
Right.
so came up with all the, people are permanently dead. Well, they didn't correct for it correctly. So when they looked through everything, the one thing that they could say is that, yes, with cannabis use, there did appear to be a transient drop in brain function, cognitive function, et cetera. But when the cannabis was removed, it seemed like the patients involved, the people involved in the studies went back to normal.
Interesting. So can you back up and explain to some of the listeners who may not understand what a transient drop in cognitive abilities, what that means?
It's just, people, you just basically no longer are operating at your level of function.
Got
People
it.
go out, have 3 beers, they are not going to do very well with crossword puzzles, you know.
Right.
So
Right.
so they did find that, yes, there was this is not unexpected drop, but as far as the concept of it causing permanent brain damage, cognitive dysfunction, et cetera, seems to not be as well supported by, at least by this study.
Got it.
So
Got it.
again, we always, try, nobody is going to recommend using, really, opiates or whatnot in the younger population for recreational use. Likewise, it just isn't something that is promoted. And, and we all have concerns where, physicians are always going to have concerns and err on the side of caution.
Right, and I agree with you. But and I was going to mention it, but you got to it first about when you talk about pediatric medicine and cannabis, because I think really that's one of the next frontiers in cannabis science.
Mhm.
Um, Most parents who are administering various different cannabis products with their children are, like you said, are dealing with some serious conditions
Mhm.
that they
Mhm.
have found zero solutions for, right? And
Right.
so in their particular situation, I think this is just for the listeners out there. We're not pushing cannabis on the pediatric community, but we're saying that a lot of these parents feel that the risk is worth the reward.
They reach that point eventually. They
Right.
certainly do reach that point. Dr. Gunter's weed thing had that little girl with the epilepsy. Gosh, to
Charlotte.
30, Charlotte, thank you.
Yep.
30 to 40 seizure episodes a day.
Right.
And it was actually impacting on her brain development.
Right.
She could, once they started using the CBD, they sought out this producer that was producing this useless strain called that had all the CBD. And once they started using it,
Right.
their seizures went down to 2 to 3 a day.
Absolutely.
So yeah, I also remember, I think there was a young gentleman, a 15-year-old, 16, he had had GI troubles his entire life. And, he started hanging out with his friends. Friends had some recreational. His symptoms got better, much more so than anything that the pediatricians had given him all these years. So the mother came in for him to get his medical card, because, like, I can't argue with success. He's better using
Right.
stuff, and all the other things we've given him has just been, borderline at best.
Right. You know
So
what? I'm going to quote you on that. You can't argue with success. Right. There
yeah.
is no argument, right? And so
No, no.
when you mentioned the GI tract and GI disturbances, and we might have discussed this in our last interview, but is it the which cannabinoids in European, or are they all working in concert together? Which cannabinoids are really having an impact on the GI? Do you think it's THC and CBD, or is it individually, or
It's
what are your
going to
thoughts?
it's going to be both. They both have different THC and CBD have different affinities for the different receptors.
Mm,
And so they actually, so there's a very complex as to when they're full agonists versus partial agonists and what that effect has on the different receptors. It's a very trying to translate that from what they observe in the lab again to clinical use is kind of a it's a little difficult to quite clearly understand, but nevertheless, the CB2 receptors, CB1 receptors, they THC, CBD enhance the effect that the anandamide and the 2-AG have on these receptors, and hence the clinical benefits that you
got it.
can get are just that much more noticeable when those are utilized.
Understood. And can we circle back for a second when you talk about the affinity of these cannabis compounds and them
Mm-hmm.
being antagonists versus protagonists? Can you speak on that?
Gosh, it's yeah, you read that I think it's anandamide that has as a full agonist to the CB1 receptor and only a partial agonist to the CB2. And I want to say, don't quote it, but I think the 2-AG is similar, except it's opposite, that it has more of effect on the CB2. So it's almost like THC, well known to again, interact with the CB1 and CB2 receptors. CBD, maybe not so much, but the one thing about CBD, it actually, remember I mentioned those other receptors
Right.
that were part of the ECS,
Right.
they're the lesser ones.
Mhm.
CB, CBD appears to interact with those also, much more
Interesting.
so than THC.
Interesting.
So the effect that you're getting, again, the ECS system, it's not just those two receptors, there's other secondary receptors. And gosh, CBD seems to just have an impact on them all.
Got it.
So again, as CBD has now become so ubiquitous in so many different products, you find at the grocery store and everything,
Right.
people are just getting, more, getting multiple different effects that they may or may not be aware of from that particular cannabinoid.
Got it. And something that's come to my mind just in this interview. When we were at the conference, there was a big conversation on terpenes and
Yes.
their effects, right? The
Yes.
science and the data is now showing
Oh,
that
oh
the
my gosh.
terpenes have way more influence than we thought. And so my question, and for the listeners who are not aware, the terpenes are the compounds that give the cannabis the aroma that we smell,
Absolutely.
right? And so when you smell that really, really stinky OG, those are terpenes that you're smelling.
Right.
And when you smell a lavender plant, right?
Mhm. Mhm.
The lavender is a terpene, right?
Right.
And so
Right.
we know, like my wife, for instance, she'll take the lavender bubble bath. We know it has relaxation effects and so on and so forth. So are the terpenes also interacting with the CB1 and CB2 receptors, or is that something totally different?
I don't know if that's actually been established with that. Terpenes, it's a different chemical compound. Again, at least from what I recall, there hasn't been any data showing that terpenes have any affinity for the CB1, CB2 receptors.
Got it.
Again, though, there are other receptors in our body that will respond to various other stimuli, and their effect, either it may be that they're getting having they're stimulating from these terpenes, and they in turn are now interacting with the ECS system indirectly to, again, enhance more relaxation, enhance less anxiety, et cetera.
Oh yeah,
So
absolutely. And I think I don't have the data to support it, but I think subjectively and just anecdotally, people respond to these terpenes, right?
yes,
You
Oh,
know,
yeah. Oh,
people.
absolutely. I mean, they've, thanks to, these chemistry specialists that we, sort of looked at high school as being, nerdy. Well, they're the ones that are actually extracting, concentrating, and then these terpenes now, and they're
Yes,
identified, I want to say close to 2 dozen at this
right.
time. And they all have, reported to have different effects. Some are overlap, some are more stimulating, and you would likely find that more into sativas, and others are more calming, and you will likely find those more in the with the other type
Indicas.
in indicas, yes,
Yeah,
and so the effects are as expected.
absolutely. Because I want to say I'm only familiar with myrcene and limonene. I'm not sure if I pronounced that right.
Yeah, those
Um,
are the big ones. Yeah.
right. And so it's so funny, that I find them to be very uplifting,
Mhm.
and I've been in places where there's a strong aroma and a young lady will walk in the room and say, "Oh, wow, it smells wonderful in here." and, and people that can definitely have uplifting effects from these terpenes, right? And I
Yeah.
think it's fascinating. And I'm really and let me back up. Big shout out to all the cannabis nerds out there who are behind the scenes doing the work, the molecular biologists, the chemists.
Oh, yeah.
Big shout out to them because they are the ones who are really shaping and framing the future of this industry. And another uh, huge part of my platform and my why and why I do this is we need more young people interested in the science of cannabis, right? I think a lot of the population has tunnel vision, has blinders on, and looking at cultivation and dispensary ownership. But to your point, the extraction of these compounds is really the future of this industry, and
Right.
understanding how the terpenes interact with the cannabinoids and so on and so forth. Um, I think that's fascinating.
Mhm. Yes, yes. And again, it's still, I like to still only still kind of scratching the surface of the potential between all the things that we can find within the cannabis plant. So,
Right, right. And so, excuse me, when we talk about route of administration, um, and the endocannabinoid system and the ECS, and we kind of touched on this in our last interview, but there might be some listeners, viewers who are not privy to that. When you talk about inhalation versus ingestibles in the GI tract, when you talk about nanotechnology,
mhm.
um, are any of these different routes of administration um, more effective on the ECS than others?
I wouldn't say that they're more effective in the sense that it just depends on how much you get into the circulation and into the body circulation, and then allow it to interact with the ECS and the receptors. Uh, as I think I mentioned, inhalation, you very quick peak in the circulation, which diminishes within an hour or two. It's no longer circulating. The cannabis itself is in the tissues because it's been absorbed into the tissues and it's doing its work there, but you can't detect it in the circulation. Ingestible forms, for various reasons, tend to be last longer,
Hmm.
at least in circulation, and at least in theory, you're probably getting more effective cannabis through ingestible forms, tincture, edibles, gummies, et cetera, than you would through inhalation. And so that increased circulatory amount of cannabinoids tend to go, well, they'll have more of an effect going into the tissues and then hence interacting with the nerves, the CB1, CB2 receptors. So it pretty much comes down to what's the most effective way for an individual to get their adequate dosing of THC, CBD, CBN, whichever it is that they're preferring, and however best achieve that. Inhalation is quick and easy. You breathe it in, it goes into circulation. Ingestible forms, well, you got stomach acid, then has to go through the liver and some of it gets broken down there. And so we're back to a lot of variables that go into just how much of any given amount of cannabis that's ingested really gets into the circulation. That's
Right.
the big variable.
Got
And
it.
nanotechnology seem to enhance the ability of the GI system and the old buccal mucosa to absorb the cannabis. Again, so again, the more you can get into the circulation, the more of a effect you can have and expect from any given dose of cannabis.
Excellent. Excellent. Thank you for that. And let's talk for a second about uh, medical professionals and their education on the endocannabinoid system. We know there's a lack thereof, right?
Yes, there is.
Can you speak to maybe, why that is? Or is that a conversation amongst, active physicians? I was super excited to see there were some uh, graduates of med school at the cannabis science conference at the Emerald conference, which I thought was great, just immersing themselves into the space. But
Right.
what are your thoughts on just the lack of education and the lack of um, information that these doctors have?
Well, I have to say, again, the vast majority of the med school curriculums do not include, the endocannabinoid system. Conservative-minded, lack of adequate studies. Um, you can't really write a prescription for cannabis these
Right.
days. So a lot of what could be and should be done at the level of education for the future generations of physicians are still lacking.
Right.
Well, kudos for those that would come out and want to learn more about endocannabinoids, because as my daughter, who's now a second year family resident, she's running in all these patients that are taking cannabis and seem to be doing well. And so she's like, well, how is it that, why is it your x-ray, your MRI looks terrible? How come the only thing you're using for your pain is, cannabis? And so she's taken on, and with this, she's come to understand just what it does, what cannabis can do for medicinal patients. But I can only just say there was recent there's a professor he has a position both at Oregon Health Science University and at the VA hospital. He's created his website to try to basically allow physicians to get more educated. And he actually takes the effort to sit down with the medical students there and talk to them about medical cannabis and the endocannabinoid system. So it's getting there.
Right. Right. Slowly but surely. We got, as long as the needle is moving forward, I guess, right?
It's just moving forward. I actually recently, there was a time when a lot of the medical the medical programs, healthcare programs, they won't allow patients to use cannabis if they're on opioids.
Right.
Most recently, one of them, it's a subtle change, but they basically are saying that medical cannabis is allowable if you've discussed it with your physician ahead of time. So it's not the same, my way or the highway approach anymore.
Got it.
So it's moving.
Right. Right. It's moving, thankfully. And part of my passion in this space is when I was studying my master's in clinical mental health counseling, all of the literature was related to the negative effects of cannabis.
Which is, I saw a breakdown of that. It was like of all the things that they wanted to try to enhance and minimize the benefits of that.
Absolutely. And,
And
and so I was very disappointed because by the time I entered into my master's program, I was fully aware of the benefits of cannabis. I had been using it in a purposeful, intentional, intellectual, academic way for a decade by then. And
mm,
so or I'm sorry, not a decade, maybe like 7 or 8 years. And so I was fully aware of that, and I was very disappointed in there's no education on the endocannabinoid system or the benefits of cannabis in the mental
Mhm.
health space,
Right.
um, particularly when you're talking about post-traumatic stress, which I honestly didn't even discover I had post-traumatic stress until I was studying my master's, right? And so I'm reading about my condition in this literature. However, I fully understand that cannabis is helping me get restorative sleep, is changing my dream patterns in the way I dream. And for anyone suffering from post-traumatic stress who uses it in that way, you know exactly what I'm talking about. But then moving forward, um, when I was working, because I'm also a licensed school counselor, so I spent some time working in the school system, and I also worked as an MST therapist, which is multi-systemic therapy in
Mhm.
the DeKalb County juvenile court system. And I'll tell you something very interesting. When another reason why I'm here, I had several clients, adolescent, teenage, 18, 19-year olds that were using cannabis to mitigate their post-traumatic stress.
Mhm. Mhm.
Um, However, they were on probation. So
Mhm.
part of their probation was that they could not test positive for THC.
Mhm.
And so this information on the benefits of cannabis and its value in terms of how it improves our quality of life is so valid um, for the medical field, mental health, but also particularly criminal justice, right? You know,
Mhm.
our
Yeah.
judges, our prosecutors, our defense attorneys, our probation officers, our police officers on the ground. Thank you for your service, all of you. We all need to be educated on this so that
Mhm.
we understand why we should not be criminalizing our youth for their cannabis use. Because one of my main focuses before I left that position in 2016, I had a client who, and we discussed this in our last interview, just how cannabis is very individualized in
Yep.
how it's processed in the body and effects and so on and so forth. So I had a client who continued to test positive after quote unquote 30 days of no cannabis use, right? So the criminal justice system still works on this myth that cannabis leaves your system in 30 days. And if you don't use it for 30 days, you should have a negative urine screen, right? So
Mhm.
number one, the urine screens that we were using, I had articulated to the court, they weren't giving us any of the therapists any valuable information, right? They're not telling us the nanogram levels of THC. They're not telling us how much they're using or when they're using or so on and so forth. And I had a client who continued to have a faint line, which they considered positive, and he was risking doing 3 years in the state penitentiary for this.
You know.
But I had a genuine relationship with him and his family. I saw them 3 or more times a week, and I genuinely believe that he was no longer using cannabis. He was a more heavyset guy, so you know his metabolism was probably different, a whole bunch of factors. But point of the story is, big shout out to Chief Judge Vincent Crawford in the DeKalb County Juvenile Court, because thankfully I had success with other clients in reducing or eliminating their cannabis use. So my voice was kind of respected in the courtroom.
Very
And
good.
and I
How wonderful.
politely, thank you. I politely articulated to the court that um, we need to have more sophisticated drug screening process that tells us more information about our clients, so that if we test them on Monday and the nanogram levels are here, and we test them on Friday and the nanogram levels are here, we know that they are decreasing in their use, right? Which is an effective
Right.
milestone
Right.
in
Right.
their treatment plan. And so um, thankfully the court embraced that. Um,
Good.
and unfortunately, I left that position for some other opportunities. But I'm certain that that had a positive effect on many young people's lives, right?
Mhm.
Because our young
Mhm.
people, we know, are treating their post-traumatic stress with
Yep.
cannabis.
Yep. Yep.
So, you know, some of them I'm sure are smoking recreationally just to enjoy the effects.
Mhm.
But I know a significant amount of young people and just adults in general are using it to mitigate that post-traumatic stress, because our young people, particularly in the inner cities, are victims and witnesses to violence and traumatic
Oh,
events
yeah.
on a daily
Oh,
basis,
yeah. Oh,
right?
yeah.
And so,
Yep.
um, not to before we wrap up, I just wanted to mention that because I think that what we're talking about in terms of the endocannabinoid system is directly related to how we all are mitigating various symptoms that we're dealing with, right? Whether it's mental health, whether it's physical health, and so I just wanted to add that. Um, what are your thoughts on uh, terpene? Are you familiar with this conversation on terpene synthesis and synthase and synthetic terpenes and just really synthetic cannabis compounds? Do they
Yeah.
interact differently with the ECS, or what is that all about?
I'll be very familiar. I'm not overly familiar with all the different synthetics that are coming out. There's a lot of uh, since to say that they're kind of on the fringe area, they do have their effects on the individuals that use them, but I can't say that I've run across any studies that actually tries to uh, implicate exactly what or how these synthetic compounds interact. I haven't seen anything. It hasn't, certainly, at least not yet, has not been any of the medical cannabis literature that I've been able to find.
Got it. Yeah, because when I
But
was at the Emerald conference, that was a conversation, and I was scratching my head like, well, we already have a real cannabis plant, right? Why do we need a synthetic cannabis plant? And so
um,
that didn't make a lot of sense to me. But
uh, and well, the wonderful world of entrepreneurship. If I can make something and sell it,
capitalism at its finest, right?
yes, it is.
Well, Dr. Hedman, I want to thank you for your time on educating me, our listeners and viewers on the endocannabinoid system. I'm sure there are going to be more questions and
Yeah.
follow-ups to this, so we can really just call this part one of the ECS,
Yeah.
because I think it's important that we have an ongoing, continuous education on this topic because it's ever evolving,
Yeah.
in
Well,
science.
the endocannabinoid system, it's in pretty much throughout the entire body and has different expressions and interactions in both health and disease. So
Absolutely.
it's a very key system that everybody needs to, medical professions in particular need to know about and be aware of. So,
Absolutely. So all the listeners and viewers, please do your own due diligence. Look up the endocannabinoid system, see what you can find on it, understand how seek the knowledge to understand how the cannabis interacts with your body and the best way you can use it. And when we circle back for part two, we'll make sure we address any questions that we have from our listeners and viewers. But thank you, Dr. Hedman, for joining us today.
thank you.
And
Very good.
Dr. Hedman from the Society of Cannabis Clinicians. Thank you so much.
Quite welcome. Thank you for the opportunity.
All right, wonderful. Talk soon.
Very good.